headache. It's one of the classic primary headaches. What are the types, clinical features, and how to treat a patient with migraine headache? Migraine headache are classically two types: migraine with aura and migraine without aura. Migraine with aura is also known as the classical migraine. Migraine without aura is known as the common migraine. And obviously, if this is known as common, this is more common. Around 80% of patients diagnosed as migraine, they have a migraine without aura. So rest of the 20% has migraine with aura or classical migraine. Classical means uncommon. What are the clinical features? The patient will have a very severe throbbing headache, and usually this is unilateral, but some cases may be bilateral, with photophobia, phonophobia. They will not be able to look at the light. They will not like listening to any sound, and often they vomit. So as they have those, they will try to lie, or they will try to rest in a quiet and dark area. Quiet and dark area, because they have photo and phonophobia. The duration of migraine may be from 4 hours up to 3 days or 72 hours. Whenever patients with migraine has aura, whenever the patient with migraine has aura, the aura can involve the vision. There can be ocular aura, there can be sensory auras, language and behavioral auras. The classic one is the visual aura, and usually this is known as the fortification spectra, where there is silvery zigzag lines, and they shimmer and they march across the visual field for up to 40 minutes. Silvery zigzag lines which are shimmering and they're marching across the visual field for around up to 40 minutes, and after that this can lead to a scotoma. There can be sensory aura such as tingling and numbness. There can be language disturbance that can mimic TIA or stroke, and sometimes the patient becomes irritable and have malaise. Now, how to treat a patient with migraine headache? In a mild migraine attack, we can use the common analgesics such as paracetamol, such as aspirin, or other NSAIDs. And if the patient vomits, then we have to use antiemetics such as metoclopramide or domperidone. And if they fail to control the headache, we can use 5-hydroxytryptamine agonist, sumatriptan, and that typically aborts most of the migraine headaches. In some cases, we can also use ergotamines. Whenever a person has migraine headaches more than 2 times per month, then we have to consider prophylaxis. And for prophylactic treatment, we have 4 options: the B, C, D, E, sequential B, C, D, E. B is the beta blocker, and usually a non-selective beta blocker such as propranolol is used. C is the calcium channel blocker such as verapamil. D is the antidepressant such as TCS. Common one is the amitriptyline. And E is the anti-epileptic such as topiramate and valproate. Those are also used in the prophylaxis of migraine headache. It's important to teach them to avoid some important triggers, such as patients, especially female with aura, should avoid taking OCPs containing estrogen, and avoidance of food such as red wine, cheese, and chocolate usually decreases the rates of migraine headache. So that's all. Thanks all for watching. Please do subscribe to my channel and hit the like button. Put your feedback in the comment section.